covered your house, we've covered your person, right? Now I want to kind of dive a little bit deeper into the weeds. I think there's a difference between a bleeder kit and a trauma kit, in my personal opinion. And I think they have different applications and one has different stuff in it. Let's talk about a bleeder kit, right? So what do you do for somebody that's bleeding, right? Put a dressing on it, put a Band-Aid on it basically, right? If that does not stop the bleeding, what do? You put a pressure dressing in it. If you have gauze, right? You pull this out, this is like your belt, and you pull it out, boom, boom, and you have this North American Rescue Emergency Trauma Dressing, right? And you have shears, needle decomp, and you have let's say you have combat gauze. This is combat gauze. It is gauze that has hemostatic dressing on it, right? It is basically something, not only gauze, but it's gauze that has stuff in it that's gonna stop the bleed, right? So what do you do with this? If you have a big wound, you're gonna take that wound, right? Let's just say this is your wound, and you're just gonna pack it in there. And you're just gonna keep packing it and keep packing it and keep packing it and keep packing it until that wound is full, until you can't pack anymore, okay? From there, you're gonna put a dressing on top. Then you're gonna take like this bad boy, right? You're gonna wrap it around real tight, and then you're gonna tie it up. Pretty simple, right? Just because the combat gauze is kind of the gold standard does not mean that the gauze that you get at Walmart's any worse, right? You can take gauze from Walmart, and if you have one of those cool vacuum sealer things, you can make a little vacuum pack of it so it's small. It won't be combat gauze, it won't have QuikClot in there, but it'll be small, it'll be compact so you can throw it somewhere, right? And you can use it and it works great. As long as it's sterile and you can put it in there and it soaks up blood, that's all you need. Now, if that doesn't stop, once you pack it in there and you dress it and it doesn't stop, well, what's the next step? The next step is a tourniquet, right? And again, this is a bleeder kit, right? The next step is a tourniquet. Tourniquet, there is kind of two different schools of thought, right? Any civilian EMS hospital doctor person that's never been overseas or never been to combat or anything, they're going to tell you one thing, and the guys that have been to combat are kind of going to tell you something else. If you have a wound, whatever, let's just say it's right here, right, and it's squirting blood out, they're going to tell you 2 to 4 inches, basically 4 inches above the wound, not on a joint, and that's where you're going to put the tourniquet, okay? How tight you put the tourniquet? Until the blood stops pumping out. This is called let's just open this up real quick. So, this here, okay, this is called a windlass, right? And you just keep tightening it until you can't tighten it anymore, until the blood stops, and you put it bloop, right in this little plastic container, and then you take this and you cover it up so the windlass can't come out. It's actually really simple, unless you've never seen one before and you don't know how to use it. All right, so again, they're gonna say 4 inches above the wound, boom, tourniquet, as long as it's not on a joint. If it's on a joint, go above the joint. Pretty simple. Dudes that have been to combat, dudes that have been overseas doing things, what they're gonna tell you is they're gonna say high or die. What that means is if my wound is down here, they are gonna take this tourniquet and they are gonna put it all the way up, right? All the way as high as they can, and that's what they're gonna do. Why? Because in combat, there's a multitude of reasons. One, maybe this is the only wound. Maybe it's their shrapnel and there's other wounds in there. Another thing is, and I don't know exactly what it's called, but when you get hit somewhere and your artery can kind of slither up in your arm, right? So maybe that 4 inches is not enough and maybe you need to go higher, right? This is always safe. It's always safe, right? You're never gonna go wrong with this, okay? I was actually just talking to 2 of my friends, one who is a doctor and a trauma surgeon, and one who has been an Army medic for like 20 some years or some shit. And excuse my dog, she's freaking out, she's in her kennel. Both of them said the same thing to me. I said, hey, what is your opinion on the higher dye versus the 4 inches above the wound? And they both said the exact same thing, so I'm going to pretty much take it as the golden standard, right? Both said, hey, if you're overseas, higher dye, bam, done, send them out on medevac, good to go. If you're at home, if you're in the backcountry, if you're hiking, or the medical aid is nowhere near you, higher dye, boom, all the way up, cinch it down, you're good to go, right? If medical is very close to you, or you live in a suburban neighborhood, something like that, then you can do the 4 inches, right? You can do the 4 inches and you're okay. The great thing about the States is, you know, hospitals are really close, ambulances are really close. So the 4 inches is gonna be okay. But again, if you have multiple wounds, let's say you have a wound here and a wound here, maybe a wound here, all the way up, okay? Where can you not put these? You cannot put these on around the neck. If you have a head wound, sorry. You can't really put these around the pelvis. That's they're kind of small, right? What do these not work on? Well, there's this big plastic thing right here. So if your arm is smaller than that, it's probably not gonna work on you. Mainly children and animals, or really, really skinny people. Other than that, the CAT Generation 7 tourniquet is awesome, right? I'll show you guys a soft T wide here in a little bit, but the CAT tourniquet by North American Rescue is pretty much the golden standard. This RAS tourniquet, like I said, this is good for children. They have a Gen 2 RAS, which from what I understand, people were asking for another 6 inches of length and a few other little things, and they kind of did it all. And now they are good to go as far as a lot of other things going, and it's not as controversial as it was. People are starting to accept that this works. The thing about this is, if you do one wrap, and this is where that's why they want extra length, right? Because if you have big legs or big arms, if you do one wrap, what is that? That's too small, okay? That's actually gonna cause damage to your tissue if you put it on like that. You need, like this is, see how this is 2 inches wide? You need at least 2 inches of wrap, right? 2 inches of occlusion to stop the blood and not create any more damage than you would. Okay, so to cover the bleeder kit, what do we have? We have gauze, bandage, tourniquet, right? That's gonna stop most of your bleeding. How many tourniquets do you need? Depends. Depends on where you're at, what you're doing, and how the person got hurt. Things like this, right? Things like a chest seal or a needle decomp. These are more what I call trauma kits, all right? Because if you don't know what you're doing with these, you can actually cause more harm than you can do good, all right? Especially with like a needle decomp. So I think with a bleeder kit, it's very simple. You can learn this in a couple minutes and everybody can do it. For a trauma kit, you need some training, right? You need some training other than from somebody like me who just has a bunch of knowledge. You need a dude who's certified in all this stuff and a dude who knows how to train somebody in all this stuff. Again, even with the bleeder kit, I'm gonna go, headlamp or flashlight. I mean, any flashlight works. These mini shears are decent. These are North American Rescue mini shears. They're really small, the size of my hand, and they can fit right in here. If you don't want to carry shears around, everybody usually has a knife on them, right? The thing about the knives is you got to be really careful when you're let's say you're cutting up a pant leg. You just got to be very careful you don't nick something like a protruding bone or, I don't know, some dude's nutsack. That would really suck. With these shears, they have a blunt tip, so you're not going to be poking anybody, and you can kind of cut around things a lot easier. All right? So let's get into a trauma kit. Okay, for your trauma kit, you're going to have everything your bleeder kit has, plus, right? So we kind of already touched on these, the hyphen chest seals, okay? There are two of them, right? Front and back. Okay, these are vented. Without going deep in the woods and this stuff, basically these are self-sealing. If somebody has a gunshot wound or a stick that went through them or a whatever rebar that went through them, you can put this on the wound and it'll vent, right? It's got two because gunshots sometimes are one in and one out. A needle decomp. If you have, without going, I don't want to go deep in the woods with a lot of this stuff. But if you have a lung that's collapsed, you can take this needle, put it in your chest. It vents the air out so your lungs can go back to normal, right? Very simple thing. I say it's simple, but that's the easiest way to explain it. You're gonna have a few extra things of gauze because for trauma, you might need more than just one single pack, right? You might need some more. You may have 2 field dressings, right? Or emergency dressings. You're probably gonna have some sort of tape. You're probably gonna have, this is something that's overlooked a lot, that I don't know why it is, but it is. These are like little survival blankets. Like this is a North American Rescue survival blanket, and this is like your Mylar space blanket, right? Those are gonna be great for shock, okay? Shock kills a shitload of people. People don't really think about it too much, but they should, because it fucking kills a shitload of people. Especially like in car wrecks and stuff. Well, what else is good for? Not only to keep somebody warm, and remember, these are real thin, so like if you have a coat or something, remember to put that on as well. But not only do these keep people warm and help them with hypothermia, let's say it's raining out and like you just had a car wreck and there's a teenage girl that just wrecked her car, she's freaking out, right? You can give this to her and at least it keeps her dry, right? At least she has something to put over her head, because even something as small as that and showing that you care just a little bit, and again, these are like $1. That's going to go a long way for her. That's going to go a long way for her mental state, to where she's not going to be freaking out. So these are, again, the same chest seals. This is just a different, it's the same brand, it's just different packaging. One's probably older than the other one. So here's another kind of chest seal. It's called the Halo chest seal, right? It really doesn't matter what kind of chest seal you get, as long as it vents and it's self-adhering, right? Again, this is a RATS. This is the newest version. Let's see. So this is, again, I always carry one of these because I have a dog, because I have kids, and because I've seen a lot of kids get hurt. And the reason why I always carry one of these, and the reason why there's controversy around this, because it's not TCCC approved, right? TCCC is the people that say, hey, this is a good tourniquet and it works. Just because they said this is not TCCC approved doesn't mean it doesn't work. Just like the SWAT T tourniquet, it still works, okay? It's just not TCCC approved. That's the only thing. If you know how to use this, it still works, and it works fine, right? This thing is small, it's super compact, and it works great with kids and animals. If you care about your kids and you care about your animals, this is a great backup tourniquet. And also, it can work on adults too. If you put this tourniquet, let's say you only have one tourniquet and the dude's bleeding out both of his legs, and you put this one on and he's still bleeding out the other leg, guess what? You can throw this one on there too. It's not gonna fucking hurt anything, all right? Other things I like to keep, little baby wipes, right? Like a pack of baby wipes in there is always good. Even if somebody, you gotta clean off their face or something like that, especially like a bottle of water. Stuff like that is always a good creature comfort for the person that is hurt. If you don't have a headlamp, I always carry at least a little light with me. You can put it in your mouth and you go hands-free. You can kind of clip it on your hat, whatever. But if it's dark out, definitely need something like this. CPR mask. So I used to carry like a couple of these, and then we went to no rescue breathing at all. So you don't really need one of these anymore if you're just gonna start pumping. But it's always okay to have. Another thing to have is a Sharpie. If you notice on all these, they have a little tab right here it's usually a white tab. You're supposed to write the time on there. Now, overseas we have learned that you can put a tourniquet on somebody and leave it on there for an extremely long time, and they're going to be fine. But it's always good to write the time on there just in case, especially like if you're in the backcountry, like hunting or something like that. There are medical professionals out there that they will tell you that after a certain amount of time that you can loosen this and then reapply it. That way, if it's up here and the wound's down here, you can get blood flowing in here. I would caution that. I would caution and say, if you're not trained, don't do it. If you are trained and you know exactly what you're doing, then by all means, I'm not a doctor. If you're not trained and you do that, and let's say you screw it up, then you possibly just have killed that dude, all right? So that's the trauma kit, right? A trauma kit's going to be what most, if not all, soldiers carry in their IFAK. What hopefully SWAT teams carry on their belt. Anything like that. Most dudes carry at least 2 tourniquets with them. I carry 2 tourniquets and a RAS tourniquet with me, along with a whole bunch of other stuff, right? From here, we're going to go into what I call your mini medical kit or a vehicle kit. This is something I carry in my truck that is good for just about every situation. And you're going to see a lot of redundancy, especially in this stuff and what's in my truck. But that's okay, because if you get in a car wreck and there's 3 people hurt, you have to have redundant stuff in order to help 3 people. You can't just rely on, hey, I'm the only one that's ever going to get hurt. If it's me, the wife, and 2 kids, and a dog, that's 5 people that I got to worry about with all this stuff. And not only that, I need to know that they know how to use it and they know how to use it properly. All right, so let's get to that.